Hello friends, welcome to a new lecture. Let us now learn some important previous year questions. Side effects of salbutamol are all except. Salbutamol is actually a beta 2 agonist. Okay, salbutamol will cause will cause stimulation of potassium entry into the skeletal muscles. Because potassium enters the skeletal muscles, the potassium present in the blood is decreased, causing hypokalemia, which is a proper side effect. Salbutamol most common side effect is tremors. Tachycardia is also seen with salbutamol because of the stimulation of beta 2 receptors in the atrium. Then hypoglycemia is not seen with salbutamol. In fact, you will see presence of hyperglycemia associated with salbutamol. Then the next question, loading dose of drug depends upon. Look, loading dose of drug depends upon the volume of distribution, because initially you should give the drug concentration that is similar to the drug which will distribute in the tissues. So if you give, see for example, if you give 1000 or for chloroquine, if you see, it has the highest volume of distribution. If it is arbitrarily, I am assuming it has 1000. Actually it has 15,000 liters of volume of distribution. 15,000 liters of volume of distribution. So first and foremost, you will have to give the chloroquine which will distribute to the whole body, covering the 15,000 liters, or else if you do not give that amount of chloroquine, if you give lesser amount of chloroquine than that. So for example, for sequestering the 1500 liters, if it requires some 1000 moles of chloroquine is required for sequestering, or for completely distributing to 1500 liters. Okay, if think that you have given only 500 moles, then the whole 500 moles goes and distributes in the tissues. There is no chloroquine required for the action, so obviously it is, the therapeutic effect is not reached. So as a result, you should give this 1000 moles in the beginning, so that this will go and gets distributed in the tissues, and the excess amount which you give as maintenance dose, that will be present in the blood, thus producing its action. So this volume of distribution depends upon the loading dose depends upon the volume of distribution, whereas clearance is mainly the maintenance dose depends upon the clearance. Maintenance dose depends upon the clearance. Then the next question, low apparent volume of distribution indicates. So whenever there is less volume of distribution is the volume through which that drug distributes to various organs. Low apparent volume of distribution is drug is not distributed to other organs and tissues. It is just the definition, as the name says. Then the next question, Diamox is given for glaucoma, which is a non-competitive antagonist of carbonic anhydrase. The effect is due to, see, whenever there is a non-competitive antagonist, there will be decrease in Vmax and Km will be constant. Whereas if there is competitive antagonist, Vmax will be constant and Km will increase. It has already been dealt in biochemistry section a couple of times. Then next question, which of the following is used to prevent acute mountain sickness? Acute mountain sickness is actually, the drug of choice for acute mountain sickness is acetazolamide. This acetazolamide is actually a carbonic anhydrase inhibitors, and it inhibits this enzyme and thus prevents the dehydration of bicarbonate. Okay, and thus this can be used in mountain sickness, it can be used in glaucoma or in edema. Then which of the following drug is gametocidal for all species of plasmodium? Gametocidal is primaquine. Primaquine is gametocidal for all species of plasmodium. This is the only drug important drug which is gametocidal, and that is the reason we give primaquine for almost all the people suffering from malaria. Then a male with next question, a male with insulin dependent diabetes having macular edema develops glaucoma. Which drug should be used as a least resort to treat? Okay, so here a patient with insulin dependent diabetes mellitus with macular edema and glaucoma, which of the following drugs should be least resort to treat? See, if there is macular edema, among all these drugs given, this prostaglandin analog can increase or predispose the formation of macular edema by itself. So obviously the patient has macular edema, so we do not want the patient to have increased macular edema, worsening of macular edema, and as a result we will not give this prostaglandin analogs to the patients with insulin dependent diabetes mellitus with macular edema with glaucoma. Then the next question, abnormality to check lithium if lithium is given to the pregnant female is. So whenever there is lithium given to the pregnant female, it results in cardiac anomaly, especially which is called as Epstein anomaly, is seen in patients who are pregnant patients taking lithium. Then the next question, if carbamazepine is added to valproate, what side effect will increase? Okay, see, valproate will cause pancreatitis, but carbamazepine does not cause it. Thrombocytopenia is seen in carbamazepine, that is aplastic anemia and thrombocytopenia are seen in carbamazepine. Okay, then hyperammonemia is actually a side effect of valproic acid. Hyperammonemia is a side effect of valproic acid. Both carbamazepine and valproate, both these will cause this hepatotoxicity. Hepatotoxicity is a side effect of both valproate and also the carbamazepine. Both these will increase the hepatic toxicity. Okay, which of the following drugs causes ophthalmologic toxicity? Anti-tubercular drug with ophthalmic toxicity, that is ethambutol, causing optic neuritis, and it also causes red green color blindness also. Optic neuritis and red green color blindness is caused by this ophthalmic by this ethambutol. Next, all of the following drugs will increase bleeding when given to the patient, increase bleeding when given to the patient on warfarin, except, so the drugs which will, see, warfarin is actually metabolized by CYP2C9. Okay, so all those drugs which will induce or inhibit this CYP2C9 will cause bleeding of warfarin. See, if they inhibit this CYP2C9, okay, if they see, the warfarin is metabolized with CYP2C9. If the drugs will inhibit this CYP2C9, obviously there is no enzyme for the metabolism of warfarin which will increase the warfarin concentration. So CYP2C9 is inhibited by isoniazid, it is inhibited by amiodarone, and it is inhibited by cimetidine. So as a result of that, all these will cause increased bleeding, whereas carbamazepine is actually the inducer of CYP2C9, and thus it will increase the metabolism of warfarin, thus decreasing the bleeding symptoms. Right? Next question. Primary action of nitrates in a patient with angina is, in a patient with angina, the primary action of nitrates is to decrease the preload. That is the primary action of nitrates. Next question. Technique given in the picture. So here there is a mouse From the mouse we have obtained spleen cells and we have fused it with myeloma cells. On fusion there is formation of hybridomas which were cultured on HAT medium for selection of positive cells. So what is this? Actually this is the process of synthesis of monoclonal antibodies. So fusion of these spleen cells with myeloma cells produces hybridoma which will produce monoclonal antibodies, which is very important. Next question. Store a drug in a cool place refers to storing at a temperature of. If you have to store a drug at cool place, refers to storing at a temperature of 8 to 15 degrees Celsius. See, this storing is very important. I will tell you the temperatures. If you have to see the freezer, for storing something in freezer, the temperature should be minus 20 to minus 10 degrees Celsius in freezer. Then in refrigerator we use 2 to 8 degrees Celsius. Cold is temperature which is not exceeding 8 degrees Celsius. Then cool means 8 to 15 degrees Celsius. Then obviously room temperature is 15 to 30 degrees Celsius. Warm is 30 to 40 degrees Celsius. And obviously if it is more than 40, that is excessive heat. So cool is 8 to 15 degrees Celsius. So in the question, cool place is 8 to 15 degrees Celsius. Then a 16-year-old girl with anti-epileptic for treatment of seizure episodes while asleep, no seizures for 6 months, and non-contrast CT and ECG are normal. What is the further management? See, 16-year-old girl on anti-epileptic treatment for seizure episodes while asleep. So this is the picture of juvenile myoclonic epilepsy, where the seizure episodes are precipitated whenever there is lack of sleep. So obviously for juvenile myoclonic epilepsy, lifelong treatment is very important for these drugs. Right? Then the next question. Next question. A patient is on indinavir, zidovudine. See, there is a patient on indinavir, zidovudine, lamivudine and ketoconazole. Develops breast hypertrophy, nephrolithiasis, hyperlipidemia and central obesity. Identify the drug causing these side effects. The side effects are actually caused by the drug indinavir. The drug indinavir is protease inhibitor which will cause these side effects of the breast hypertrophy, nephrolithiasis, hyperlipidemia and central obesity. Then next question. Which of the following is correct regarding T3 and T4 acting on TRH? See, T3 and T4. Regarding T3 and T4 acting on TRH, whenever there is whenever there is think that there is increased T3 and T4, then through negative feedback mechanism it decreases TRH. And this T3 and T4 and TRH are actually nuclear receptors. Because they are nuclear receptors, they act by transcription factors. Right? Next question. Morphine should not be given in a patient with biliary colic, because morphine will cause spasm or contraction of sphincter of Oddi and thus causes biliary spasm. So because morphine itself causes biliary spasm, we should not give it in a patient with biliary colic. Then next question. Dapsone is used as an antibacterial, antifungal and immunomodulator. Mechanism of action. It's simple. It combines with para-aminobenzoic acid in folic acid. Morphine combines with competes with para-aminobenzoic acid in folic acid synthesis. Next question. Dapsone is used. This dapsone question is done, right? Then schedule of drugs sold only on prescription. The schedule of the drug sold only on prescription is Schedule H drugs are only sold on prescription. Schedule H drugs are only sold on prescription. So these schedules are also very important. We have Schedule C, which is for biological products like serum or adrenaline, and we have Schedule E for various poisons. Okay, Schedule F for bacterial vaccines. Then Schedule G for those drugs which should be used with caution. Schedule H, which should be those drugs which should always be given with a valid prescription. Then we have Schedule J, the list of diseases which cannot be treated under any drug now. Right now we do not have any drug for this Schedule J. Then we have Schedule M. Schedule M is presence of good manufacturing practices are seen in Schedule M. Schedule P for expiry period of the drug formulation. Schedule T is for Ayurvedic, Siddha or Unani products. All the Ayurvedic, Siddha and Unani products are sold under Schedule T. Then we have Schedule W, which is for generic names only. Schedule W is for marketed generic names only. Then we have Schedule X. Schedule X for psychotropic drugs. Schedule X for cytotropic drugs requiring special license for manufacture and sale. Then we have Schedule Y. Schedule Y for those drugs which are used in clinical trials. So these are the different schedules which are important. Then next question. In rheumatic heart disease patient, prosthetic valve, pregnant woman with prosthetic valve, when should you switch to heparin? Heparin is actually a intravenous drug, right? So you will have to switch to heparin in 37 weeks. At 37 weeks of gestation, you should switch to heparin. Before 37 weeks of gestation, we actually give warfarin to the patient. At 37 weeks of gestation, we will shift this patient from warfarin to heparin. Then phase 1 trial is done to test the dosage. Phase 1 trial is the first trial which is done to test the dosage only. Okay, whereas phase 2 trial is done to check the efficacy. Phase 3 trial is done to confirm the efficacy. Phase 4 trial is for monitoring the safety of the drug. Even the phase 3 trial is also done for confirming the safety and efficacy. Okay, next question. Mechanism by which acetylcholine decreases the heart rate is. Acetylcholine acts on the muscarinic receptors, especially M2 receptors, and causes delayed diastolic depolarization and thus decreases the heart rate. It causes delayed diastolic depolarization and thus decreases the heart rate. Then next question. Nitroprusside active metabolite acts by. Nitroprusside will actually produce the nitric oxide. This nitric oxide activates the guanyl cyclase which converts GTP to cyclic GMP and thus causing vasodilatation. So obviously this nitroprusside acts by guanyl cyclase. It acts by guanyl cyclase. Then the next question. Pediatrician attended infant with unconjugated serum bilirubin level of 33 mg per deciliter. which drug mother might have taken in the third trimester. So what is the drug which is causing methemoglobinemia and hemolysis in the neonate? The drug is cotrimoxazole. Cotrimoxazole is the drug which is causing the both neonatal hemolysis and methemoglobinemia is caused by cotrimoxazole. Next question. Dose reduction is required in renal failure for all of the following drugs except doxycycline. Actually, drugs like doxycycline are safe in renal failure. Then there are questions can be asked, what are the drugs which are safe in renal failure? So safe in renal failure drugs include, first in the tetracyclines we have minocycline, doxycycline and tigecycline, which is MDT. These are tetracyclines which are safe in renal failure. Then we have macrolides like azithromycin, clarithromycin and erythromycin. These are safe in the renal failure. Azithromycin, clarithromycin and erythromycin. Then we have fluoroquinolones like moxifloxacin and pefloxacin are safer in renal failure. Then cephalosporins like cefaperazone and also cefpiramide. Cefaperazone and cefpiramide are safe in renal failure. Then oxazolidinediones like linezolide is safe in renal failure, and lincosamide like clindamycin is also safe under renal failure. Then we have streptogramins like quinipristone and dalfapristone are safe under renal failure. Okay. Then the last question of this class is, for the patient of hypertension on metoprolol, verapamil was given. This will result in, see, metoprolol is actually a prolol. So it is metoprolol, which is a beta blocker, and this verapamil is a calcium channel blocker. So both these will actually inhibit the heart, and thus both these can cause bradycardia with AV block. So we generally do not combine the verapamil with metoprolol. Thank you for watching.